If your knee keeps hurting during squats, running, or even walking upstairs, the problem might not actually be your knee. Most people treat the pain. They ice it, they rest it, they wear knee sleeves, but very few people understand the biomechanics causing it. And until you fix that mistake, the pain keeps coming back. Knee pain is one of the most common complaints in gyms and sports. People blame age, they blame genetics, they say they just have bad knees. But the knee is rarely the true villain. The knee is what we call a middle joint. It sits between your hips and your ankles. That means it depends heavily on both of them to function correctly. When your hips are unstable or your ankles are stiff, the knee absorbs stress it was never designed to handle alone. Over time, that stress builds into irritation, inflammation, and eventually pain. Now, let's understand the anatomy. The knee joint is primarily made up of three bones: the femur, which is your thigh bone, the tibia, your shin bone, and the patella, your kneecap. Most people think the knee is just a simple hinge that bends and straightens. And yes, it performs flexion and extension, but that's not the full story. The knee also performs slight rotation and gliding movements, especially when you squat, run, or change direction. Supporting the knee are major ligaments like the ACL and PCL, which control forward and backward movement. The MCL and LCL control side-to-side stability. The meniscus acts as a shock absorber. And then you have muscles like the quadriceps, hamstrings, and glutes contributing to movement and stability. Here's something important. Several of these muscles don't originate at the knee. The glutes originate at the hip. The hamstrings cross both the hip and knee. That means the knee depends on proper function from other joints. Now here's the biomechanical mistake most people miss. They treat the knee as an isolated joint, but your knee does not operate independently. It relies heavily on hip stability and ankle mobility. If your glutes are weak, your femur tends to rotate inward during movement. When that happens, your knee collapses inward as well. This movement is called dynamic knee valgus. Dynamic knee valgus dramatically increases stress on the patella, ligaments, and cartilage. Over time, repeated stress leads to pain in the front or inside of the knee. Now let's apply this to a real-world example. Squats. During a proper squat, your hips move back, your knees track over your toes, and your ankles allow controlled forward movement. But if your ankles lack mobility, your knees compensate by shifting excessively forward. If your glutes are weak, your knees collapse inward. Now your knee joint is absorbing force alone instead of distributing it through the hips and ankles. And that's when discomfort begins. This is why many people feel knee pain during leg day but never address hip strength or ankle mobility. Let's look at common mistakes. Mistake number 1, ignoring glute strength. Weak glutes mean poor hip control, which leads to inward knee collapse. Mistake number 2, poor ankle mobility. Limited dorsiflexion forces compensations at the knee. Mistake number 3, letting knees cave inward under fatigue. As you get tired, mechanics break down. Mistake number 4, lifting heavy without movement control. Speed without stability increases joint stress. Most people buy knee sleeves for support. Very few fix the underlying mechanics. So how do you prevent knee pain? First, strengthen your glutes and hamstrings. Focus on hip extension and hip abduction exercises. Second, improve ankle mobility. Work on dorsiflexion drills before heavy training. Third, train proper knee tracking. Your knees should move in line with your toes during squats and lunges. Fourth, slow down your movements. Control builds joint stability. Think of your knee as a force transmitter. When the hips and ankles do their job, the knee functions efficiently. When they don't, the knee pays the price. Let's recap. Your knee isn't weak, it's overloaded. The real problem is often poor biomechanics from the joints above and below it. fix hip stability, improve ankle mobility, control your alignment. Understanding anatomy isn't about memorizing structures. It's about moving smarter. If you want to understand your body at a deeper level and prevent injuries before they happen, subscribe to the channel. Your knees will thank you.